Good morning. Welcome to Salina Regional's Morning Medical. Today's program, I have with me Dr. Bradley Irvin from COMCARE, a family medicine physician. Thank you for being on the show. I think I want to start out and talk a little bit about your residency and your training and how that prepared you for family medicine.
Well, I would say really my training started in medical school. I went to the University of Kansas and spent the second half of that in Wichita, and really got a lot of expertise and some experiences there that a lot of medical students don't get. And so by the time I came out of my medical school, I already had a very solid foundation in procedures in the clinic as well as colonoscopies, which ended up being an interest of mine later on in residency. And I was lucky enough to be able to study under several doctors that were very good at doing them as well as teaching them, and came out with a high number and skill level and ability to do them.
Let's talk about, I've always wanted to kind of ask this of a physician. You know, you walk into the room and your patient's there, and sure enough, they've got a printout of a bunch of Google answers and Google symptoms and diagnosis, and they know exactly what they want. How do you work with a patient like that?
The patient that you're talking about comes in with information they've looked up on the internet, Google or WebMD, and we would my goal would be to go over it together, add their knowledge and what they've looked up to my own training and expertise in the area, and really work to get them to the destination that they're aiming for.
Okay. You're talking about communication with the patients. Let's talk about communicating with them, even outside of the office visit.
Well, inside the office, I'd like them to educate them, be able to give the information so that they're able to make their own decisions, because really nobody knows better what they want to do than them. As far as outside the office, we've had a lot of success recently with the patient portal that the hospital has started implementing. We've been able to see some quicker turnaround times to answering patient questions. We're able to cut out some middlemen. It's a little less paperwork, and the patients that are using it, I think, have been very happy with it. Now, we also have several patients that don't understand it, don't want to use that at this point. And we're happy to still work through the older methods of calling my office on the phone as well.
Thank you very much for being on the show. Thank you for watching. To become a patient of Dr. Irvin or any other COMCARE doctor, please call COMCARE at 785-825-8221.